This is such a great day. Thank you all for being here. Thank you so much for spending your part of your morning with us because this is a monumental time in our history, in Kansas City's history. When we look at the statistics, when we look at providing safe passage for our families, we know that there is so much work to be done. And the doula program that we're starting citywide as a pilot project will help us to make sure that we're supporting mothers, we're supporting our babies, and just making sure that we're addressing the issues with maternal and infant mortality. Just being on the council, this is definitely something that I feel strongly about just from a council and policy lens, but it's also something that, I've been working on for a very, very long time through the work of the Black Healthcare Coalition. And so to know that we have partners in our community that have been working to make sure that we have a strong workforce for doulas, because we understand and know that this is a critical tool, this is a part of care because of what's missing in our system. And so we appreciate not only the doulas that, had the foresight in Uzazi Village, who had the foresight to put this program together, been working more than 10 years, almost 11 years now, Uzazi Village, with building our community so that we can be more responsive to these needs and to these issues. But this is something that I am extremely excited about. I want to thank our health department director for making sure that this is operationalized. We put together a resolution that my office led to say that we need a citywide doula program. We need to make sure that we're not only ensuring that families have direct access to these supports, but we're also building this workforce. And so we're extremely excited about partnering with Uzazi Village to do this work. The city cannot do this alone. We need people that are on the front lines, that are working with families day in and day out, and you all are doing that work, and we thank you for partnering with the city to make this happen. Again, I want to thank the staff, I want to thank our partners, and thank the community at large. We know that we have work to do to make sure that this is something that we can grow and that we can expand. This is a pilot, and we want every mother in our city to have access to this resource, especially Black mothers who are experiencing the deepest disparities as it relates to maternal and infant mortality. And so we know that we're just beginning, and this work is on the start of this, but we will continue to grow. And if there's anything that my office can do to support you, please let us know. But thank you all for being here. It's a great day, and we're very excited.
All right, good morning, and thank you. Welcome to the Kansas City, Missouri Health Department. My name is Dr. Marvia Jones. I am the health director. I am really proud that we are able to play a role in this process. I'm very grateful to the people who have been in the trenches doing the doula work, both those that are present and those that are not present with us today. Thank you for what you do. The reason that the Kansas City, Missouri Health Department is so interested in supporting this initiative out of Councilwoman Robinson's office is because there are some sobering facts about maternal mortality. So a report that was recently released showed that in the state of Missouri, an average of 60 women die every year, specifically between the time period of 2018 to 2020, and 85% of those deaths are preventable. And so we realize that it is important that we work locally to address the issues that we have, and to make sure that people are not dying from preventable illnesses in this wonderful country of America from something like childbirth. That should not still be the case. And so we are excited to partner with Uzazi Village to offer this service. We used a very data-driven approach to understand which parts of the city had the highest need, and so those areas would be prioritized. We're happy that to be able to provide and share in this pilot service that would basically allow for people who cannot afford a doula, because I know they have a big heart for this work and they're very passionate, but they can't do it for free all the time, to be able to support them. So it's a win-win. The people who need a doula but can't afford one, as well as the doula who is available to provide this service, Again, this is for any doula that is in our area who can serve. They would be able to be a part of this program. So we're just really excited about this, and this being able to, in some small way, contribute to some of the solutions to the issue of maternal and infant mortality in our city. We are also happy to support those and answer any questions that folks might have afterward. Thank you.
Thank you. Hakima Payne with Uzazi Village. I want to start by thanking our mayor and city council for supporting this initiative, but specifically Councilwoman Melissa Robinson and her office for putting forth this visionary idea that I know can absolutely be a model for the nation, for other cities in our country to address the dire epidemic of Black maternal health inequities. So we're very excited and very honored for Uzazi Village to partner with our city to bring these services to residents of Kansas City, Missouri. We're very excited to open this opportunity up not only to residents of Kansas City who need a doula, but doulas within Kansas City, Missouri who want to serve through this initiative. So please contact us. I also want to give a special thanks and shout out to the Uzazi Village Board, who's represented here this morning, and to my amazing and wonderful staff and COO. Thank you so much. And I want to say a special thank you to our doulas who are out there on the front lines doing this work every day, working with our residents, helping to make better perinatal health outcomes, who are with mamas and families in the trenches, day in and day out, on call, around the clock, answering the call when families go into labor and their babies are coming, and our doulas are right there by their side, advocating for them in the healthcare arena. We know doulas work. The research already tells us this. We just need access. And our city has shown, and our health department has shown, absolute visionary response by making this initiative available to those in our city who can't afford a doula but will absolutely benefit from the presence of one. So thank you all. We're delighted to be a part of this collaboration for the good of our city and for the health of our babies. Thank you so much.
It is at this point that we're going to open it up for questions from the media. Could you guys join us up here, please? Thank you.
Any questions? You guys have any questions? Good.
I think we all would prefer if we just did kind of like one-on-ones and interviews.
Okay. Okay, great. One of the things I did, Mama Hakima, do you want to just kind of share what a doula is, like just the basics?
Yes.
Okay.
Great. So for clarity, for those who are unfamiliar with what a doula is a non-medical professional who provides support to childbearing persons and families during the perinatal period. The perinatal period would be pregnancy, birth, and postpartum, all three together. We call that the perinatal period. And doulas operate in all those periods of time to educate, inform, navigate, to comfort, to lend support, and that might be physical support, spiritual support, social support. Doulas also offer resources when families have needs. So they're an all-around, I think of them as pregnancy and birth navigators that assist families with the support they need during the childbearing arena.